Did you know that even with metastatic breast cancer, you are more likely to die from heart disease than the cancer itself? This is supported by studies that showing that for many breast cancer survivors, especially older women, that heart disease is more likely to be the cause of death for them than the cancer itself. And one huge thing that could help is hormone therapy, but it's still stuck with a bad reputation it's had since 2002. So why are we overlooking what might be one of the most supportive tools for women's health? In today's episode, we're busting myths and revealing what HRT could do for your mood, your heart, your mind, and even your libido. Welcome to Ageless Island, your destination for staying strong, sharp, and ageless inside and out. Just as a reminder, I'm not a doctor. I just want to share what I've been through and my experiences and the research I've done, and hopefully it can help one of you out there. I'm so glad you're here. Let's jump right in. So we're in a position now where both women and doctors don't understand or even fear hormone therapy, thanks to the Women's Health Initiative that rocked the world in 2002. So what this study did was it linked hormone replacement therapy to breast cancer and increased risk of heart disease. And the media went crazy. The study was stopped, and all the headlines said hormones cause breast cancer. But what the media didn't tell us was that most of the women in this study were over 63 years old. They'd been in menopause for a long time. They weren't having any symptoms, and they were already in a demographic that was more prone to breast cancer and to heart disease. Plus, they used synthetic hormones. So they used Premarin, which was female horse urine. They used a synthetic progesterone, not at all like the bioidenticals that we have available to us today. So as a result, we have a generation of women and doctors that are terrified of hormone use. But we have some great news. So there's modern research showing that modern bioidentical hormones behave really differently from the old synthetics of the past. They might even be protective. We even have vaginal estrogen, which may not systemically impact the body. So it's often safe for breast cancer survivors under medical supervision from their doctors. When I was first entering menopause, I found this quote that really struck me. So it's a quote from Suzanne Summers, and she said that back in the day, women had babies, we went through menopause, and then we didn't live much longer after that. But now we're living decades beyond menopause, and that's why we need hormones. After reading this, I really started doing my research, and I really thought about it. It makes a lot of sense to me that with all of the hormone receptors in our bodies that affect almost every part of our body, that we would need hormones to help us continue to live healthy lives as we age. So I want to go into a little bit about what these hormones are that I'm going to talk about, just in case you don't know the different variations. So the main hormone I'm going to talk about is estradiol, or E2. It's the most potent estrogen and what's typically used in HRT today. It may protect your heart, your bladder, your bones, and your skin. Then we've got estriol, or E3, which is considered the protective estrogen, but it's not as strong. So there's a lot of studies being done because it is considered protective, but we just don't know how to increase its effect on the body since it is such a weak hormone. It is associated with lower breast cancer risk and often used in vaginal therapy. Then we've got progesterone. And again, I'm not talking about the old synthetic. We're talking about the natural micronized form that can be protective of your mood. It can help you sleep, and it protects your uterus from building up too much tissue when you're taking estrogen if you still have a uterus. Then we've got estrone, or E1, which is rarely talked about, but it is what dominates after we go through menopause. It's, thank goodness, a weaker hormone, but it can be inflammatory if it's not balanced. It's not used in HRT, and it has been linked to estrogen-sensitive cancers like breast cancer if it's not combined or countered with estradiol. So luckily for everybody, the HRT landscape is changing. There's modern research today that's challenging WHI assumptions and changing medical minds, which is great for women. So there's new data from Europe and long-term studies like the E3N cohort and the ELITE study trial that suggest bioidentical estrogen may not increase breast cancer risk. And if you start HRT within 10 years of menopause, it can possibly reduce all-cause mortality, resulting in better cardiovascular outcomes. And then you got micronized progesterone, and it appears safe, even protective, versus the synthetic forms. But of course, we need long-term study data to prove this out. Cardiologists and longevity experts are now agreeing that HRT can support vascular health and metabolic health, and even now mitochondrial function. Many are now thinking that the risk of not being on hormone replacement far outweighs the risk of being on it. There was a 2024 study in Menopause magazine that was really interesting. It showed that women on a monotherapy of estrogen that were over 65 actually had a lower mortality and reduced several chronic diseases, including breast cancer, lung cancer, colorectal cancer, and even dementia. So more and more medical providers now think that the risk of not keeping women on hormones is riskier than keeping them on hormones. So if you're learning something new today, or you find this video helpful, please like or subscribe. It lets me know that I'm on the right track and giving you information that you find helpful. So hormones aren't just for hot flashes. That's always associated with menopause, but there's a lot of other benefits that hormones can possibly have with other parts of your body. So let's start with heart health. So estrogen keeps your arteries flexible, can help reduce plaque, and can regulate your cholesterol, reducing LDL and increasing HDL. It also helps against inflammation and oxidative stress. As far as bone density, and this is major, I mean, for me, it's really important. I have a big risk for osteoporosis. My mom has osteoporosis, and it's affected her bones quite a bit. So that's something I want to be sure I'm on hormones to protect for. According to the Osteoporosis International, menopausal women not on HRT will lose about 10% of their bones in the first 5 years of menopause. So that is huge. And then women on HRT, estradiol specifically, will lose about 2.5. So that's a big difference in the rate of bone loss on HRT versus not on HRT. And this is where it's important to look at whether you're on a lower dose estrogen or a higher dose estrogen and looking at the blood levels. A lot of doctors, once you get those initial labs done, they feel labs aren't as important as what your symptoms are. And if your symptoms are good, then you're probably on the right dose. But if you are concerned about your bone health, studies have found that you need to have levels above 50 parts per milliliter to have potentially fewer fractures and better bone density and decrease your risk of osteoporosis. And they're also looking recently at progesterone because it can also stimulate bone formation. So studies suggest that if you combine progesterone with estrogen, you might even have more effective bone protection than one alone. And then there's brain function. And this is fairly recent research too. We've known for a while though that estrogen or estradiol can enhance your serotonin and dopamine activity, but it also supports your mood, your vocabulary fluency, and memory. It can even reduce your risk of Alzheimer's when initiated early in menopause. So look at these two brain scans that are taken both before and after menopause. These were provided by Dr. Lisa Marconi's research of Cornell Medicine. Notice the areas in the postmenopausal brain with less yellow and red activity. That's showing that the brain is actually functioning less and gets less energy to it after there's not as much estrogen going to the brain. There was also a 2023 Cedars-Sinai study that found that women who began HRT before menopause had a significantly lower risk of Alzheimer's risk, but of course more research is needed to confirm this. And then there's bladder health, and this is huge because this is like brand new research. We now have new clinical guidelines from the American Urological Association, the AUA, and the Pelvic Health Societies that recognize vaginal estrogen not only for dryness, but for UTI prevention. It has a demonstrated safety profile being low dose, local therapy that doesn't significantly raise the systemic estrogen levels. Even the FDA safety data suggests that local vaginal estrogen can reduce complications like sepsis in certain populations, especially women in long-term care. And this is crazy. Over 50% of women in these long care facilities have reoccurring bladder infections or UTIs. And studies looking at this data found that if at least 30 to 50% of the women were put on vaginal estrogen therapy, they could benefit significantly from this therapy and have a way better quality of life. Then as far as testosterone goes, a lot of us think, oh, that's a man's sex hormone, women don't need testosterone, when in reality, it can be really important for women's muscle mass, for our bone health, and for our physical stamina. Also, for your sex life, it can increase your arousal, satisfaction, and your motivation. Then on top of it, if you add estradiol, it can improve your vaginal blood flow. It can improve elasticity and natural lubrication that will increase sensitivity and make your intimacy more comfortable and pleasurable. It's awesome because today we have so many choices on hormones and how we can use them and take them. So I'm going to start with pellets. That's my favorite. I'll get into it a little bit more later in this video. But they're bioidentical, they're long-lasting. Mine last for around 3 months, but they've been shown to last as long as 6, and they produce steady levels in your body. Cons, they're expensive. Not many insurance, if any insurance companies cover them. Also, once they're in your body, you're pretty much, you got them until they wear out. So if you're new to hormones, you should try a cream or a gel and try it out to see what levels work with your body and to see how hormones impact your body before you talk to your doctor about possibly switching to pellets. And then another potential side effect is it can raise your testosterone levels to high enough where you can get some adverse side effects like facial hair or a deepening of your voice. Luckily, I haven't experienced that, but everybody's different. There's patches. They've been around for a long time. They're easy to apply. They bypass the liver, so a lower chance of blood clotting, which is awesome. And they deliver steady streams of estradiol. They're also covered by a lot of insurances, which is really nice. On the cons, they can irritate your skin when it's hot outside, like in the summertime, if you're swimming, sweating, they can peel off. They have to be applied once or twice a week, so that can be a nuisance. There's the creams and the gels. These are great because they're customizable by your compounding pharmacy, but they're a little bit less predictable. You don't know, on the con side, you don't know how well they're going to be absorbed. Some days they'll be absorbed pretty well. Other days you may not feel them. That's my experience on them. I'd like to know yours, so if you're on creams, let me know what you think of them. But they're useful for women that are sensitive and can't use some of the other forms of HRT. Another thing to consider in the cons is you can transfer it to other people. So if you are using creams or gels, be really sure that you don't touch anybody else in the same location where you applied your creams. Then you've got the oral pills, which are the mainstay as far as progesterone goes, but not as good for estrogen and testosterone. Again, it's well tolerated in progesterone, but the oral estrogen can increase your clotting risk because it is metabolized through the liver, and it also can raise your triglycerides. So if you're already having issues with high cholesterol, it may not be the way for you to go. Then they say as a downside, oral progesterone can lead to drowsiness. In my opinion, I think it's more of a positive because many women that can't sleep actually use progesterone to help with their sleep and getting a good night rest. Then there's troches, and I just learned about this a couple weeks ago when we were doing a music show down in Mexico, in Isla Mujeres. They're actually a little bit thicker, and they go under your tongue, so they're absorbed by the veins there. They provide for rapid absorption. Your compounding pharmacist can customize them, and they're not processed by your liver. The problem with these, though, is the rapid absorption can cause spikes or dips in your hormone levels because it happens so quickly. Another con is they can dissolve really slowly, so people using them can be tempted to chew on them or to swallow them prematurely, so then you don't get the full effect of the hormone strength in your body if that happens. They also can taste bitter. And then, of course, we talked about vaginal estrogen for bladder relief and vaginal dryness. So it's a really great time to live when we have all these choices on hormones, and the medical community is getting more and more on board in giving us these options. So as far as my story with hormones, I never had issues with hard periods, so I was really lucky. And then perimenopause hit. And then I had super heavy periods. I had clotting. My cycles were irregular, and I ended up getting an ablation. Looking back on it with some of the things I know now, that was possibly not needed. It turns out that your estrogen levels in perimenopause can get a lot higher, and your progesterone really drops, which can lead to an imbalance. So possibly if I had just increased my progesterone levels, it may have alleviated my symptoms enough where I wouldn't have needed the surgery, which in my opinion is always better. So if you're in perimenopause and you're having symptoms, the good news is you don't have to wait to get on HRT. You should check with your doctor, see if it's for you. It's so funny too. I always looked forward to menopause because I was always cold, and I thought the hot flashes would be nice because I'd finally be normal and not cold all the time, but it didn't turn out that way. So I was in a job where I presented often in front of groups of people, and I would feel that off feeling, kind of nauseousness, And then I knew the sweats would come. Then I would be so drenched. I'd be rosy cheeks. My hair would be sticking to me. My shirt would be wet. And that didn't work. I felt like it was wrapped in saran wrap and the heat just couldn't escape from my body. If I was at home and it hit, I'd stand in front of a freezer and I would still be extremely hot and couldn't cool off till it was over with. And then at night, I would wake up super sweaty. I couldn't cool off. And then once it was over, I would be wet and colder than ever. And days in between my hot flashes, I would be colder than ever too. I used to call them cold flashes, and I would be so cold in between. So that was the worst part for me. So I started using hormone creams, and for a couple of years, they worked really well. I felt much better. I was having less hot flashes, a lot less symptoms, but then for some reason, they just stopped working. Luckily at that time, I ran into a friend who recommended a provider in town that used pellets for HRT. So I got my labs done and provided my mammogram to her, and she said I was a good candidate, so I decided to give it a try. Now, I am not a fan of needles. I don't even watch needles go in my arm for blood tests or shots. So I was a little bit nervous because it is a procedure. So the worst part for me is they actually numb your butt cheek and that needle kind of wiggles around, and I don't like that feeling. But then you don't feel it after that. But then for a couple of days afterwards, you do need to be careful. You need to watch how you sit in chairs or how you lay in bed or turn over. But within a few days of being on my pellet, I felt so much better. I felt like me again. So now I feel like my body gets a steady stream of hormones. I don't have to think about it. It's nice because it's only every 3-month thing. I love them, and I hope I never have to stop taking them. I honestly feel like I'm back to being in my 30s again, and I got my spark back in every way. It's funny because I talked a friend of mine into talking to a doctor about pellets, and she got on them, but I didn't tell her about all the side effects. And she saw me a couple weeks after being on them and came up to me and said I should have warned her, because now her husband couldn't keep up with her and he was having to consider going on testosterone. So she thought that was pretty funny. So if you're wondering if HRT could be right for you, there's some things to ask yourself to look for some symptoms outside of hot flashes. Are you tired, foggy, or do you just feel emotionally blah? Are you losing bone or muscle density even though you're exercising the same as you always did? The other thing is your waistline growing. So is your fat being redistributed? For me, I always carried fat in my thighs and my bottom. And when I started getting into menopause, I started getting some in my fat in my belly. And that had never been my issue. Have you had bladder issues start to creep in? And this is one I never associated with menopause, but frozen shoulder is a lot more prominent because you're losing that lubrication you get in your joints from the estrogen. Is sex uncomfortable, or have you lost your sex drive? If you've answered yes to any of these, you might want to consider talking to a HRT literate provider. You deserve to feel good again. Be sure to ask the questions. Get your labs done. So the Women's Health Initiative over a decade ago has kept women from living vibrant lives and feeling as healthy as we could. So imagine the lives that could have been different if women and doctors had known then what we know now about the potential benefits of hormone replacement therapy. But remember, I'm not a doctor. I'm just someone sharing what I've been through and what I've researched and hoping that my experiences can help you. So if you have a doctor that's not up to speed on some of the current information, you might want to consider finding a different doctor. Also, there are plenty of online doctors now that specialize in HRT. Take a look at this list of online providers with what their specialties are. I will also provide them in the show notes section of this video, along with these star ratings showing how they've been rated by users. I would love to hear your thoughts and your personal experiences on hormone therapy and also your experiences with menopause. So drop a comment below and start a conversation, and hopefully we can all start talking. If this video helped you or sparked your interest or curiosity, please like and subscribe. It really helps me out. I hope you'll tune in next time and listen to my next episode, Lost Smell, Mitochondrial Blue Magic to the Rescue. Until then, stay strong, stay sharp, and stay ageless. I'd also like to thank the wonderfully talented John Patty for allowing me to use his steel drum music in my videos, and thank you for watching.